You guys.
Well, fat burners, the little pills promise to help you shed the pounds with little to no effort on your part, but do they really work? To help us separate the fact from fiction is Dr. Willey from Physicians Immediate Care for Today's Health. Thank you very much for stopping by.
Thank you.
First off, fat burners, what do they actually do biology-wise? What do they do to your system?
You know, I break them up into 3 or 4 primary types. You have your lipolytic agents, which actually utilize fat as an energy source, which I'll cover. You have your mood enhancers, so you feel better, have more energy, exercise harder, therefore burn more fat.
Okay.
You have your diuretic versions, which just burn water off you, but they're given fat burning credit. Okay. And then you have your appetite suppressants that slow down your eating, so there's less energy coming this way, so your body starts utilizing it down here. The ones that are most common and popular are the ones that claim to be lipolytic, so they burn fat while you're exercising, enhance your mood, so you exercise harder, and control your appetite. Those are the ones that really kind of fit together as this is what our product does. The biology behind it is lipotropic or lipolytic agents really do cause the fat cells or encourage them to release fat so the fat's available in the bloodstream and thereby utilized as energy. Okay. So during exercise in particular. But at the same time, they also tend to enhance mood because a lot of them are what we call sympathomimetics, or they mimic the sympathetic nervous system. They give you a good feeling, norepinephrine's released, in some cases a little bit of dopamine's released. Okay. You feel better, you exercise harder, you have more energy, and therefore you burn more fat. Okay.
So what is actually in these? How do they accomplish or claim to accomplish these goals?
Excellent question. Probably the most popular one and most common is caffeine. Caffeine at certain doses, greater than 300 milligrams at a time, actually causes the fat cells to release fatty acids into the bloodstream. So when that fatty acids are present and you're exercising, it's going to be utilized as fuel. Okay. So caffeine's your #1 lipolytic / fat burning agent. Now those fats floating around, if it's not utilized, will be deposited.
So it just comes back. Okay.
So another popular component of these fat burners is something called L-carnitine, which takes the fat cells, puts it in the mitochondria, which is the powerhouse of the cell, and that's utilized then. So you actually will use more of the fat that you've released using the caffeine. Okay. Other products like phenylnephrine, yohimbe, these are all sympathomimetics, so they give you kind of a buzz to exercise, and through different mechanisms, which I won't bore you with, help utilize fatty acids as energy sources.
Now, in total, do these things actually work? I know I tried one time. They hyped the raspberry ketones. All I did was burp raspberries, to be honest. Yeah. So do they do what they claim? Do they actually work?
Yes, they really do. However, you still have to exercise hard. You have to control your calories in your diet. It's a big picture thing. Okay. Just doing nothing different, not exercising, not eating right, taking a fat burner ain't going to do you a squat. Otherwise, you're sitting there and go like this all day.
A little jittery.
A little jittery, and that's about it. Now, you may burn some fat because you're jittering so much, but in the big picture, it's not going to change the scale.
All right. Well, thank you very much for stopping by.